afternoon. I'm Eliza P. Cordova from BSN M3B, and for today, I will be demonstrating on how to transfer a patient from the bed to the wheelchair and vice versa. So, first, before you start the procedure, of course, you need to review the medical record and nursing plan of care for conditions that may influence the patient's ability to move or to be positioned. So this is to ensure the right patient receives the right intervention. And then, if this is a critical setting, you need to assess the tubes, the IV lines, incisions, and other equipment that may alter the positioning procedure to prevent the risk of injury. And then, identify um, any limitation in physical activity of the patient. And then, perform hand hygiene and PPE if necessary. So it is to prevent the spread of microorganisms, and you will need to wear PPE if it is based on transmission precaution. So after that is you need to identify the patient. So state by stating her full name, um, birthday, and checking the patient's wristband for to double check um, if you are in the right patient receiving the right intervention. So, ma'am, um, I'm Rin Cordova. I am a student nurse from Our Lady of Fatima University, Pampanga campus. May I know your name po?
I'm Mariel Cordova.
Um, Kailan po yung birthday mo po? Check ko lang po.
July
Okay po, thank you po, ma'am. So, after that is you will need to explain the procedure to the patient. So, ma'am, Dr. Cordova have ordered you will need to go to the X-ray room for some tests. So, I will be assisting you. I will be transferring you to the wheelchair po. So, I'm asking for permission po to touch you. Is that okay po? Okay po, thank you po. And then after that is in the clinical setting, of course, you will need to adjust the bed. But yeah, adjust the bed of the patient, and then assist the patient in a sitting position. So, ma'am. And then you will need to stand um, near the patient to prevent any risk for falls and injury. So you will need to assess the patient if there is any balance problems or complaints of dizziness. So ma'am, nung in-assist ko po kayo sa pag-upo, nalilo po ba kayo or nalilo po kayo? Hindi naman po. So okay, that's good po. Then after that, of course, is you will let the patient sit for a minute so that her circulatory system will adjust because of the change of position. Then I will put the patient's slippers for comfort. And then here's my wheelchair. So I will make sure that the brake is secured so that it will not move. So if you are using a chair, you will need something to brace a secure object so that the chair will not move and prevent the patient in falling or resting. So I have secured the wheelchair, and then I will put on my gloves. the patient to stand and put her on the wheelchair. So, ma'am, 1, 2, 3. So, nararamdaman niyo na po ba yung yung parts sa wheelchair? Then, just like that. And then, of course, you will need to, what do you call this? Bring down this, bring those down. Those, the foot support. And then place the patient's feet on them. And then remove the gate belt. Remove the gate belt and you will release the brakes. Then it's finished. So that's how you transfer the patient from the bed to the wheelchair. So now I will be and then the patient can go, he can assist the patient to go to the X-ray room. And now, after that, so tapos na yung mga procedures that the patient will do, is I will be transferring my patient from the wheelchair to the bed. So again, you will need to secure the brakes to prevent fall and risk of injury. And then, assume that I already perform hand hygiene and hand rub. Again, assume that I have already performed hand hygiene and hand rub and put on my gloves. And then, I will put the gate belt again to the hips of the patient to provide support when you are assisting the patient in standing up and transferring her to the bed. Then, after that, then, you will need to fold the footstep so that you can access or support the patient's leg when you transfer them in the bed. And then, you will need to lean near to the patient, of course, to prevent the patient from falling and getting injured. So on the count of 3, you will assist the patient. You will assist the patient to stand. So 1, 2, 3. And then slowly transfer her to the bed and remove the gate belt. Remove the gate belt, and then of course, then you will need to remove the patient's slippers and then place the patient in a comfortable position. In a comfortable position, and then remove gloves and perform hand hygiene. So that's how you so that's the end of my visual presentation and demonstrating how to transfer the patient from the bed to the wheelchair and vice